Hello and welcome to Pregnancy Info. Today we will discuss the risks and benefits of pregnancy at 40 age. Some women prefer to plan their pregnancy at age 40. However, many of these women are concerned about the adverse effect of late pregnancies on their baby's health and their own health. If you are planning to get pregnant at 40 but unsure of the decision, you should understand that with age your fertility decreases. After reaching your 40s, the egg quality also doesn't remain the same. However, this doesn't indicate that pregnancy is impossible at 40. Chances of pregnancy at 40. It depends on how far you are into your 40s. During the early 40s, your chance of conceiving is about 20% and it depends upon your menstrual cycle. The percentage further deteriorates to 15% during your mid-40s. After 45, your chances of getting pregnant reduces. The number of eggs begin to diminish by this age and the fertility rate decreases. Your reduced fertility not only depends upon the number of eggs but also upon the quality of the egg. Now we will discuss the advantages of getting pregnant at 40. Though your fertility rate decreases with your increasing age, there are certain benefits associated with having a baby in 40. Number 1. Financially stable. One of the greatest merits of having a baby in your 40s is that you are financially stable to take their complete responsibility. At this age, your career flourishes and you reach to a secure and stable condition that you can support your family in all aspects of life. Number 2. Raising a kid in a positive environment. As you get the chance to spend long years with your life partner, you know each other in a better way. The bonding is rather strong and the family offers a solid foundation for their children's upbringing. Young parents have a tendency to fight and quarrel due to a financially unstable condition. It often leads to divorce, which can affect your child's mind. Taking mature and wise decisions. As a mature individual, you will possess the ability to make wise parenting decisions for your baby. Now, the disadvantages of getting pregnant in your 40s. There are certain health and pregnancy complications associated with pregnancy after 40. If you conceive in your older age, it is better to remain in an extra care during your sensitive phase. Here are some of the common health issues that you may face during pregnancy in the 40s. Number 1. Diseases. When you conceive as a mother, late 40s, it increases your risk of suffering from numerous health diseases which include gestational diabetes, preeclampsia, placental abruption, high blood pressure, and placenta previa. During the 40s, some of common issues you come across are irregular periods and fertility problems. Consult with the gynecologist as they prescribes effective medicines to cure the menstrual disorders. For fertility issues, your gynecologist recommends you to visit a fertility specialist. Number 2. Pregnancy complications. There are several birth complexities associated with getting pregnant in 40s, such as cesarean section, low birth weight of the baby, awkward position of the baby, and premature birth. In the 40s, the egg are likely to develop a certain chromosomal problem that leads to miscarriage and low birth weight of the baby. Do you know what decreases fertility with increasing age? Research concludes that most females about 40 suffers from ovum-related issues, which is the primary cause of infertility. With appropriate medical treatment and restoration of the ovarian cycle, the female reproductive organs in 40 years old become competent enough to bear a healthy pregnancy. There are some useful tips to increase your success rate of getting pregnant at 40 years old. By making some lifestyle changes, you can increase your success rate of getting pregnant in the 40s. For example, consult an experienced gynecologist. It is better to remain in touch with an experienced gynecologist who prefer the requisite medical tests to diagnose your fertility conditions. Your doctor guides you through right treatments and methods which increases your chances of conceiving in the 40s. The medical practitioners perform a routine examination of your body that usually consists of a pap smear and pelvic exam. The checkup takes about 15 to 20 minutes. Deal with existing health problems. If you had any complex health problems, you need to treat those conditions before pregnancy. If you are overweight, try to lose your extra pounds by eating nutritious foods and practicing regular exercises. Get enough medications for any chronic health ailment such as high blood pressure and thyroid diseases. sexually transmitted infection disease, your chances of conception decrease. So, inform your doctor about your health discomforts and get effective treatment for the sexually transmitted infections and disease immediately. Follow a healthy regime. If you are willing to increase your fertility rate, it's important to make lifestyle changes and stay positive about life. Try to give up the habits of smoking and taking alcohols as they adversely degrade the fertility rate. To reduce stress, you can try practicing healthy exercises including yoga, cycling, swimming, jogging, and even walking in your daily regime. Get plenty of sleep to keep you rejuvenated. Sufficient rest eliminates harmful toxins from your body and helps to live you a stress-free life. Consider fertility treatments. It becomes difficult to conceive after 40, so you may need fertility treatments to increase your success rate. Talk to doctor about some effective fertility-enhancing drugs or treatment options. The doctor may recommend you to take hormonal injections of HCG to boost your fertility rate. The rate of multiple births is usually high with such treatments. If your reproductive system is damaged and it interferes with the process of conceiving, the doctor may suggest a surgical procedure. Maintain a healthy body weight. Obesity is one of the leading factors to impose infertility in high BMI. The significant alternation in the normal ovulation rate usually occurs due to higher BMI. Avoid vigorous eating and starvation, as high nutritional deficiency greatly hampers the secretions of endocrine hormones. Practice healthy exercises to lose your extra pounds. Avoid intake of hormonal supplements for weight reduction. Consider donor eggs. At this age, your ability to conceive naturally is quite low. That's why it's a great idea to consider donor egg if you want to conceive. Home remedies to increase your success rate of getting pregnant in the 40s. Here are some home remedies that may help to elevate your chances of getting pregnant in your 40s. It is very important to keep a close track of your menstrual cycle and remain acknowledged about your fertile days. The fertile period lies on the 14th day of your menstrual cycle and the next 10 days. Monitor and record your basal body temperature and practice frequent intercourse at or around the time of ovulation. A slight increase of your body temperature indicates that you are successfully ovulating, and it is the best time for sexual intercourse. Use an ovulation predictor kit that indicates the successful ovulation days and increases your chances of conception. Monitor the substantial changes in your cervical secretion. It enables you to understand whether the embryo successfully implants to the uterus or not. Avoid performing strenuous physical activities, especially running, riding stairs, and lifting heavy weights during the course. Performing sexual intercourse in different positions elevates your chances of pregnancy at 40. The doggy position is mostly preferred or baby making as the sperms deeply penetrate. Experts suggest that soft massaging of the uterus helps in promoting blood supply and enhances healthy development of uterine tissue. Fertility cleansing helps your body to get rid of toxic waste that your body releases during the normal metabolic process. Elimination of toxic waste increases your chances of conception. Herbal remedies to boost fertility in the 40s. Healthy, nourishing fertility supplements such as extract of fresh garlic, vitamin C, and grapefruit juice helps in boosting the fertility rate in your 40s. You can also use saw palmetto, false unicorn, red clover, maca, and vitae. Here are some things that you have to remember. Drink plenty of water as it helps to keep your tissues hydrated and healthy. Water easily keeps your appetite full, decreases your food cravings, and prevents you from gaining extra weight. The hormone secretion increases and your chances to conceive boosts naturally. Increase your intake of antioxidants in your diet. The effective elements neutralizes or kill free radicals and protect your egg from any damage or chromosomal complexities. Stress, anxiety, and worry degrade the production of healthy female reproductive hormones and restrict proper blood supply to your reproductive organs. Try to lead a stress-free life. Practice yoga or meditations to improve your chances of getting pregnant at 40 naturally. So, this is all about the advantages, disadvantages, and risks of being pregnant at age of 40 or later 40s. So share this video with the female who are trying to conceiving at this age and want to know the knowledge about it. Take care and bye-bye.